Hello, and welcome to this quick guide to understanding and completing the consent form for cardiovascular therapy of peripheral arteries. This video will walk you through the key steps of the procedure and key section of the form to ensure you are informed and confident in your decision. Let's take a closer look at what peripheral artery disease (PAD) is, the steps involved in your treatment procedure, and the key points to consider before moving forward with your care. 1. What you need to know about peripheral artery disease. 2. What will happen during your procedure. 3. Reviewing the consent form. In this section, I'll explain what peripheral artery disease is, how it affects your arteries, and why it's important to treat it. You'll learn about the symptoms you might experience and how this disease can impact your overall health. Peripheral artery disease, or PAD, is a condition where arteries in your legs and sometimes arms become narrowed or blocked. This is usually due to plaque buildup known as atherosclerosis. As a result, blood flow is reduced, and tissues don't get the oxygen and nutrients they need to function properly. The most common symptom of PAD is pain or cramping in your legs while walking, which typically subsides when you stop moving. This is known as claudication. You might also experience numbness, weakness, coldness in your lower legs or feet, or wounds that don't heal. If left untreated, PAD can progress and cause more severe complications like ulcers or even limb loss. AD is primarily caused by atherosclerosis, where plaque builds up in the arteries, narrowing them. Several factors increase your risk of developing PAD. These include smoking, diabetes, high blood pressure, high cholesterol, being over 50 years old, a family history of heart disease or PAD, and leading a sedentary lifestyle. Managing these risks is key to preventing or treating PAD effectively. Your procedure aims to open narrowed or blocked arteries, improving blood flow to relieve symptoms like pain or cramping, and support wound healing. This will enhance your mobility and overall quality of life. Let's walk through the steps together. First, we'll begin by having you lie comfortably on your back on the procedure table. The doctor will then numb the area around your groin with local anesthesia to ensure you feel minimal discomfort during the procedure. Next, the doctor will gently insert a small tube called a sheath into your artery through a tiny puncture in your groin. If you feel any discomfort during this step, the doctor can apply more local anesthesia to make sure you remain comfortable. In this step, the doctor will use the sheath to insert a catheter and inject a contrast agent into your blood vessels. This will allow detailed imaging of your arteries using X-ray, helping to guide the procedure accurately and identify any areas of narrowing or blockage. In the next step, the doctor will carefully guide a thin wire through the narrowed or blocked artery. This is an essential part of the procedure to prepare the artery for treatment. In this step, the doctor will use a small balloon to carefully widen the narrowed or blocked section of your artery. This process helps restore proper blood flow, whether the artery is completely blocked or just partially narrowed. In some cases, the doctor may place a tiny metal tube called a stent inside the artery. This stent helps keep the artery open and prevents it from narrowing again in the future. To finish the procedure, the doctor will close the puncture site and apply a pressure dressing to prevent bleeding. Afterward, you'll need to rest in bed for about 3 to 6 hours to ensure proper healing. After we've explained your condition and the planned procedure, we ask that you carefully review the consent form. It provides an overview of the planned procedure. For each section, please indicate whether you understand the information, or if you would like to review it further or wish to ask any additional questions to your doctor. The form provides an overview of the planned procedure, including the use of a catheter to treat narrowed or blocked arteries, possible techniques such as balloon dilation, stenting, or aspiration therapy. Take your time to read this section carefully. This section outlines potential risks, such as minor bruising, allergic reactions, or in rare cases, more severe complications like kidney damage or the need for further surgery. Ask your doctor if you have any questions about these risks. After the procedure, follow-up care is crucial. For instance, keep the pressure dressing intact. Adhere to prescribed bed rest. Avoid bending your leg or sitting up too soon if your leg was treated. These instructions help minimize complications and support recovery.
Complete the checklist honestly. Key questions include: do you take blood-thinning medication? Do you have any allergies or kidney problems? Are you pregnant or breastfeeding? Your answers help the medical team plan your procedure safely. Once you've read and understood everything, you will need to sign the form to confirm your consent. If you have any doubts or need clarification, do not hesitate to ask your doctor before signing. If you have additional questions or concerns, you can reach out to the angiology department at the contact numbers provided. Thank you for taking the time to review your consent form carefully. Key items that you will need to click and agree. 1. Confirm understanding of the procedure and risks. 2. Acknowledge awareness of alternative treatments. 3. Agree to follow post-treatment instructions. 4. Answer the yes/no checklist accurately. 5. Sign to consent or decline the procedure.
Thank you for taking the time to go through our guide, understanding and signing the consent form for peripheral artery treatment. We hope this information has been helpful in clarifying the treatment process and your role in it. If you have any further questions or need additional guidance, please don't hesitate to reach out to your healthcare provider or care team. Your well-being and confidence in your treatment plan are our top priorities. Wishing you the best on your journey to better health.